Good afternoon, Marcus Rubin. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
You can now start your OET roleplay.
Good morning, Mihiraa. I'm Marcus Rubin, one of the nurses on duty today. I understand you had a bit of a rough night, and I'm here to spend some time with you this morning, go over a few things, and answer any questions you might have. How are you feeling right now?
Oh, good morning, Marcus. Honestly, I'm still feeling a bit scared and confused. My chest still hurts, and I just don't understand what's going on. One minute I was fine, the next I was here.
I can certainly see why you'd feel that way, Mihiraa. It must be very unsettling to experience chest pain and suddenly find yourself in the hospital. My main purpose today is to gather a few more details about what brought you in and explain what we'll be doing next to help you. We want to make sure we understand everything so we can provide you with the best possible care. So, to start, can you tell me in your own words what happened that made you come to the hospital?
Well, yesterday afternoon, I was just at work, and suddenly I felt this sharp pain in my chest. It came out of nowhere. I've never felt anything like it before. My colleague insisted I come straight here.
Thank you for sharing that, Mihiraa. To help us get a clearer picture, could you describe the chest pain a bit more for me? When exactly did it start? Where exactly do you feel it? And what does it feel like?
It started around 3 p.m. yesterday. It's mostly right in the center of my chest, but sometimes it feels like it spreads to my left arm a little. It's mostly a sharp, stabbing pain, but sometimes it feels like a heavy weight pressing on my chest. It keeps coming and going. Even now, it's there, but not as bad as yesterday.
That gives us a much clearer idea, thank you. When you were experiencing that chest pain, did you notice any other symptoms along with it, like feeling short of breath, or perhaps feeling nauseous, or even breaking out in a sweat?
Yes, definitely short of breath, especially when the pain was at its worst. I felt a bit sick to my stomach too, and I was sweating a lot, even though it wasn't hot. I just felt very unwell.
It's completely understandable to feel anxious when you're in the hospital, especially after experiencing chest pain. I really appreciate you sharing all those details with me. Mihiraa, it helps us get a clearer picture of everything. I want to reassure you that while you're here, we're keeping a very close eye on you. We're continuously monitoring your vital signs, things like your blood pressure, your heart rate, and your oxygen levels, to make absolutely sure everything stays stable and that you're safe. Please, do you have any questions or concerns right now about the monitoring or anything else we've discussed so far?
Not about the monitoring itself, but I guess I'm just wondering why all these tests are so important. Will they actually tell us what's wrong?
That's a very good question, Mihiraa, and it's something many patients wonder about. These diagnostic tests, like the blood tests we've done and the ECGs, are incredibly important for several reasons. Primarily, they help us to rule out any serious underlying conditions that could be causing your chest pain. By looking at specific markers in your blood or the electrical activity of your heart, we can determine if it's something like a heart issue or something else entirely. It also allows for early detection of any problems, which means if something serious is found, we can start managing it as quickly as possible. Ultimately, the results of these tests will guide us in determining if further intervention is needed, meaning they will help us decide the best next steps for your care and create an accurate and effective treatment plan. That's why it's so crucial not to ignore them.
Not about the monitoring itself, but I guess I'm just wondering why all these tests are so important. Will they actually tell us what's wrong?
It's perfectly natural, Mihiraa, to feel anxious when you're dealing with symptoms like chest pain and finding yourself in an unfamiliar hospital setting, especially when you're waiting for answers about what's going on. I want to reassure you that you are absolutely receiving care at the right time and in the right place. We're doing everything we possibly can to figure out what's happening. And the good news is that once we have the results from your tests and understand the cause of your pain, there are almost always treatment options available to help you. We're committed to making sure you get the best care possible here. Is there anything particular you're worried about at the moment, or any other questions popping into your mind?
Not right now. I think you've explained it well. But I do worry about this happening again.
That's a very valid concern, Mihiraa. While we're still determining the exact cause of this episode, it's always a good time to think about managing your overall heart health. We can work together on reducing cardiac risk factors. Things like smoking cessation, if that applies to you, are hugely beneficial. Adopting a healthy diet focused on fruits, vegetables, and lean proteins, and getting regular exercise are also key steps. Learning ways to manage stress effectively is also very important for your general well-being. Looking ahead, I also want to stress the importance of follow-up care once you leave the hospital. This means we can monitor your recovery properly, make adjustments as needed to any medications or lifestyle changes, and crucially, help you avoid any potential complications down the line by proactively managing your health. We want to ensure you stay well long after you leave us. How does that sound?
This sounds really good, Marcus. It's a lot to take in, but it makes sense. I really appreciate you explaining everything so clearly.
You are very welcome. Please take good care, Mihiraa. We're here for you if you need anything at all. Just use your call bell.